Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle.
Medicare Foundation hosts blood drive in Ghana to raise sickle cell awareness. The UK-based Medicare Foundation launched its first blood drive and health fair in Ghana to increase awareness about sickle cell disease and promote blood donation. "We are here to promote good health and well-being," said Nana Hagen Sherry, CEO of Medicare Foundation. Sickle cell is a genetic condition that requires regular blood transfusions for many patients. Unfortunately, there are many misconceptions around the disease, with some people even believing it's contagious. Part of our mission is to change that. Sherry, a former military nurse, highlighted her personal commitment to the cause. "I've lost friends to sickle cell, and I've seen firsthand the difference blood donations made."
So my name is Nana Hagen Cherry. I'm a Ghanaian born. I live in Manchester in the UK. I've come from the UK to come and start an initiative here. So it's an initiative that has been going on in Manchester for about a year plus now. So we are Medicare Foundation and we promote good health and well-being. We advocate for sickle cell patients and promote awareness and on blood donation. As you already know, or people might know, that sickle cell is a condition that affects people. It's a genetic condition. People are born with it. You cannot catch sickle cell. But there's a lot of misconceptions and a lot of myths surrounding sickle cell. Sickle cell patients sometimes require blood transfusions or exchange regularly, 4 to 6 weeks. So our passion is to encourage people, to promote and create awareness for people to donate blood to help the sickle cell patients. Because what we realize that people think giving is just going to church and giving an offering or giving clothes or giving money, but that's not just giving. Donating blood is also an act of giving. So we want to encourage people and promote the awareness to let people understand that you can donate blood to give as an act of giving as well. And that's the reason why we've come to Ghana to bring it here, to come and have this blood drive and have this health fair to create the awareness on sickle cell and to encourage people to give blood. So as you can see, we've got the National Blood Service of Ghana here. We've got the Kolebo Sickle Cell Unit and National Clinical Genetics here as well. So they are doing the actual blood drive, taking the blood from people, and we are also going around engaging people and talking to them about sickle cell to create that more awareness about it for people to understand. Sometimes people feel that when you've got sickle cell, nobody wants to come close to you because you're going to catch it. You cannot catch sickle cell. You are born with it. But we need to be able to be accommodative and be advocates for people that live with the condition. So that's why we are here today.
So somebody would ask you, there are other aspects of things that you could do. Why did you decide to choose sickle cell as a foundation, as a field of the foundation?
Okay, so sickle cell is very passionate to my heart because I've lost friends to sickle cell. I served in the British Army for 13 years as a military nurse, and whilst I was in the army, I came across a lot of people that donate blood, and that was when I got to know more about donating blood linked to sickle cell. So when I understood that concept and I realized that even in the UK there's a lot of cry for blood, for people to donate blood, then I realized that what are we doing? The sickle cell is very prevalent in the black community. However, the black people are those not donating blood. Although the condition is very prevalent with us, we are not donating the blood. So I did a survey and spoke to people, and I realized that it's not that people don't want to give blood, it's just that people lack the understanding. There was no awareness about it. So when you talk to somebody, the person will say, "Oh, I've never thought about it," or "Oh, I don't know. I don't know why I'm not giving blood. But once you explain to them and make them aware that this is what is surrounding sickle cell and what you can do as an individual or as a person to help or support a sickle cell patient is to donate blood, they go like, okay, then why not? I can donate blood. So I realized that it is the awareness that people lacked, not that they didn't want to. So that is why I went into sickle cell. That is why I decided to do sickle cell and blood donation. Although there are other aspects of the foundation, sickle cell and blood donation is the main thing that we focus on. But we've got other aspects of fitness and exercises where we engage people into fitness so that they understand that in order to live long, you also need to consider exercising and having some movement in your bodies to be able to live longer. So we try to engage people. We've got a tennis club back in Manchester called the Manchester MF Community Tennis Club, where we get people in the community to come and do tennis. So you just turn up, we give you a racket, we give you a ball, and then you play tennis. We've got a tennis coach there. But our main focus is blood donation and sickle cell awareness. I don't live here in the country, so it was a bit, there was a bit of anxiety coming into do it as to how we're going to engage people to actually come and donate blood. And when I spoke to people on the ground, I heard a lot of myths and misconceptions as well as people not wanting to because they want to save their blood for when their family members needed it. But I've seen people trooping in and actually engaging and donating blood. So I'm really glad and I'm happy for the success of what's happening today. And this being the pilot project, we're hoping to make it annually and do other events as well to help to promote sickle cell and blood donation.
With support from Ghana's National Blood Service, Code Unit, and National Clinical Genetics, the event featured blood donation stations and educational sessions to dispel myths and encourage donations.
Sickle cell patients from all over. Over my years of working there, what I've noticed is that most of the patients who come in are coming in with pain, and occasionally some also come in with a drop in their HB. So they tend to require blood transfusions as well. People should know their status so that when they are going out, they are getting married, they are getting ready to have children, they know what they are going into. So you don't have somebody who is AS, another one who is AS or AC, and the first time they find out is when their child is sick. That happens a lot. That happens a lot. So we don't want those kind of situations. So a lot of premarital counseling. But if there happens to be a child from their marriage or their relationship that has sickle cell disease, what we advocate for is early hospital attendance. Because currently what program is running out now is the newborn screening. So that right from your first day of life, we can know where you stand in terms of sickle cell and even other medical conditions. Those children who come in early and they are put on some of our treatments, including hydroxyurea, chronic transfusion, they tend to do better than those who they will be there till they find out from one big event, one serious admission. That's how they got to find out that they are sickle cell. You realize that there's a difference in the quality of life. So those who come in early, they tend to do better. Because the main thing, to answer your question about how dangerous is that it can be a very silent disease. So you can have people who have sickle cell and for many years they are fine. And all of a sudden, crisis after crisis after crisis, the next thing you hear, they're on admission, and unfortunately, some of them can even die. So in terms of the dangers, that's what you have. It can be silent. And one of the things we are having now is that, okay, with more and more improved treatments, we are getting people coming with complications. Okay, you have the sickling going on every single time, every day. You are forming sickle cells. They are sickling, and they can damage the organs. Particularly, your brain can be affected. So you can have when you have a sickling that's significant, and you can have a stroke in the brain. Sometimes you can even have people who have kidney disease. Their kidneys have shut down. Very early age, the kidneys are gone. It can affect the heart, give you heart failure. So it's quite, and then one of the common things we notice too is the bones. Okay, it can easily affect the bones, and that limits, your activity, what you can do, the kind of work you can do, how active you are, and all. Some of them even require surgery in order to save their limbs. So in terms of how dangerous it is, it can go all the way to that point. So that's why once again we advocate a lot of Hospital, come to the hospital. Come and let's see you. We'll grade how severe the condition is for you, where you stand, and then we'll be able to help you out. And of course, we are appealing once again through various medium for more blood donation, more education. Let's get everybody on board. Sickle cell is not a curse. Sickle cell is not. It's not your fault. It's nobody's fault that they are born with sickle cell. Sickle cell is actually a product of love. Two people are in love and they had a child who has sickle cell. So let's not let that child suffer because of stigmatization, because we think they are sickless, we think they like attention, everything, I'm in pain, and all those things. Let's do our best as we can. If there's a sickle cell person around you, a family member, a friend, make sure to encourage them to come to the hospital. Make sure to tell them that there are treatments available. It's not a cure, but it will make life so much better for them. Thank you.
On the other hand, the visionary Norman Foundation sees its partnership in recent health initiatives as a vital contribution to society. At a health fair and blood drive event, Abraham Norman Norty, founder of the foundation, shared the motivation behind their involvement.
The reason for us partnering for this particular program is to ensure that we also contribute our quota to the society. There have been a lot of programs that we are into, ranging from health, education, scholarship, among others. So this is one of them in terms of health that we are also contributing to the development of our country. Because when it comes to sickle cell, it's something that is not always pronounced or talked about. So a way for us to make sure that the public can be able to hear about it is why we are here today with them as a whole. So I'll leave that to Doc to also give some perspective of the reason why we are here.
Okay, we also want to create awareness to the community about sickle cell. I think as the month of October just ended, there's a lot of talk about breast cancer, there are a lot of talk about other diseases, and sickle cell is not mentioned much. But we have this disease in our country, and kids and older people are suffering from sickle cell. So we want to create the awareness, and we also want to donate blood to the sickle cell division at El Kolibo. That's why we are here today. The kid had fallen or the kid is ill, but the kid is having a crisis, which is a sickle cell crisis. So you need to go to the hospital for them to check the kid out.
It's awesome to donate blood. I understand that blood is going a long way to help Ghanaians, sickle cell patients, pregnant women, and even children. And as a Ghanaian, I feel so proud to donate blood to help save lives. So I'm very proud to donate blood today to save lives. Right. Looking at the process and then going through the process myself, I didn't experience any pain. So I don't know the kind of pain, the misconception it's about. With all Ghanaians, every Tom, Dick and Harry, if you are in the position to donate blood, do it willingly. Because if you are not able to bring forth money from your pocket to buy, and you are able to donate it freely, it goes a long way to help the indigents. So I'm entreating all Ghanaians to wholeheartedly donate blood for a healthy
Hi, my name is Georgeline Elliott. I'm the founder of Black Blood Matters and I come from the UK. And today I'm here with the Medicare Foundation supporting their blood drive and promoting blood donation. So as I mentioned, I'm from the UK, but I'm here in Ghana partly for work, but then also to share whatever time and expertise I have to just make sure that this event is as successful as possible and that as many lives are saved as possible, because every time you give blood you can help to save up to 3 lives, and there's so much good that can come for just that small simple act. So if you've ever thought about it, if you've ever wondered more information about giving blood, please come down today. Learn, ask questions, give blood if you can, and continue to use your voice to both raise awareness about blood donation and support those in our community.
Coach CJ here from TNU, an online fitness community for women from all walks of life. We're here in appreciation for what the organization has to do as far as donating blood and the importance of making sure that we have enough blood within us in order to share with other people. And with TNU, we come in because we are very much focused on the health and well-being of our women. And we say women because the women are in charge of the kitchen, and from the kitchen the men and the children get to be fed. And when we're able to do this, we regulate the types of meals that we are able to cook. So we make sure that we infuse our meals with things that are very beneficial to us to help cleanse our blood and to help us be able to build, on all the things that we need in order to have a strong immune system, which benefits us within the home and outside of the home. So I like to encourage you, wherever you are, take your health serious because our health is our wealth. Thank you.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.